I want to welcome everybody to the program tonight. If you don't know me, my name is Dr. Jason Banta. I'm the Extension Beef Cattle Specialist stationed out of Overton. All right, so tonight's topic is developing a herd health program. And this is one that I don't know that we talk about quite as often as some of the other topics, but it's probably one we should spend a little bit more time on because there's a lot of components to it and there will be some variation between operation to operation. You'll see some of the components we've covered in separate topics previously. And so when we get to those, I won't get into as much detail, but I'll kind of hit some of the high points. It's just as a reminder, you can go back to previous programs and watch those. But if you have any questions on those, happy to answer those questions tonight. So I will talk about some brand names of some products tonight. It's just easier to do that in certain situations. So if you see a brand name here, we're not necessarily trying to endorse that product. Or if you see something left off the list, it doesn't mean A&M AgriLife Extension is necessarily trying to discriminate against that product. It's just you can't put everything in the presentation. So when we think about what are the components of a herd health program, and a lot of people, when they think of a herd health program, they think about vaccination, and that's a key component, and that's actually a topic that we've talked about in a little more detail in the past, and we'll talk about it some tonight. But when we think about an overall herd health plan, it encompasses quite a bit more than just vaccination. Nutrition is an important part. Internal parasite and external parasite control are important parts. Identifying some common diseases in your area, and so we'll talk about those. Biosecurity considerations, and we'll talk about some practical things there. Vaccination. If we do get an animal that's sick, what are some treatment considerations? And then what are some other considerations that we need to have for a herd health plan? And we'll talk about some things in relation to disease transmission and those kind of things. Just as a reminder, your herd health plan and your vaccination program will vary based on the type of operation you have and your risk level. And when I say type of operation, a lot of times we'd be talking about a cow-calf operation versus a stocker operation. Obviously, a stocker operation is going to be higher risk than a cow-calf operation. And then if you're a cow-calf operation that's pretty much a closed herd, meaning you're not bringing animals in very often, and when you do, maybe it's just a bull or something for breeding purposes. Are you more of an operation that's often bringing in animals with unknown history into your operation? And so we would have different risk level in those scenarios. So just a couple things when we think about nutrition. If we have a nutritional deficiency, what can that cause? Well, that's going to cause a reduction in immune function. And that reduction in immune function comes from a couple different things. One is if we have nutritional deficiencies, that animal is going to have less ability to fight off infections. That animal is also going to have less ability to mount immune response. So when we give a vaccine, the body's responding to that and building antibodies. And if we don't have that animal in a good nutrition or good plane of nutrition, they won't build as many antibodies to whatever pathogen we're vaccinating against. And then also there's the ability for the body to keep pathogens out. And so the skin is a very important part of our immune system. Kind of example we can think about there is zinc is very important for our epithelial or skin health. And if we have some issues with zinc, we can increase the risk of foot rot in our operation. And so nutrition does play a role in a herd health plan. Now, when we think about nutrition, energy and protein are by far the most important. So we want to make sure we're keeping those cows in a good body condition score and we're meeting their protein needs. That is by far the most important. I know there's a lot of talk about mineral and vitamin nutrition, but mineral and vitamin nutrition doesn't really mean anything if we don't take care of energy and protein first. And then when it comes to mineral and vitamin nutrition, it's about appropriate nutrition. And so if we have a mineral deficiency and we correct that deficiency, that's advantageous. However, we have to be real cautious because getting too much mineral can actually be toxic in some situations, and especially when we talk about copper and zinc. So it's about hitting the right amount. We want to correct those deficiencies, but we don't want to create large excesses that cause a problem. And I tell you, in a lot of situations these days, we'll run into more problems of too much mineral than not enough. So that's just something to be aware of. Kind of a thing you can keep in mind there. If you're using a good loose mineral supplement and those cattle are eating the targeted level, that's all you need. You don't need other feed products out there with the mineral package in there. We don't need to be using drenches. We don't need to be using injectables and those kind of things in most situations. Just a good loose mineral is more than adequate. Or if you're using a loose mineral, if you're using a well-formulated mineral tub, that could also be adequate in those situations. And then on the other side of that is making sure we're not doing things that would cause problems from a nutritional standpoint. And so when we do supplement with certain concentrate feeds, we need to make sure we start off slowly how much we feed and gradually increase the amount we're giving those animals. Because if we give them too much too quick of most feeds, we're going to drop rumen pH. When we drop rumen pH, that leads to subacute acidosis and acidosis, which both of those lead to liver abscesses, where literally we have an abscess in the liver. That's not good. The liver is a very important metabolically active organ, so you want that liver as healthy as possible. The other thing is we'll increase foot abscesses in those animals. So we need to make sure what we're doing from a feeding standpoint is not causing additional problems. The other thing is if we damage that liver, that can actually make it easier for certain pathogens to grow and cause disease. So we want to make sure we avoid those nutritional deficiencies, and we also want to make sure when we're supplementing those cattle, we do it in a manner that doesn't cause issues with rumen pH, subacute acidosis, and acidosis. So when we think about internal parasite control, appropriate and strategic treatment of those internal parasites is important because it improves animal performance. That's one of the main reasons we do it. But the other thing is it actually improves the ability of the immune system to function as well. So we know if we have a heavy internal parasite load that oftentimes cattle won't respond to vaccination as well, and they're more likely to get sick also. And so we want to make sure we're treating for those internal parasites appropriately. And we've covered that in one of the previous Ag in the Evening sessions. Now, kind of as a reminder, remember when we talk about internal parasite control, our treatment strategies will vary based on annual rainfall. And high rainfall areas, typically we need to look at deworming twice a year. So for East Texas, that's going to be late May or June, and again, November or December. If we're out west where there's 12 inches of rainfall in West Texas, we may not need to deworm at all in those situations. Now, we may actually deworm from a lice control standpoint, but actually from an internal parasite standpoint, it may not be needed in that environment. So depending on where we are, will impact that. The other thing that will impact that is geographical location. So internal parasite transmission patterns are different for the northern United States than they are for the southern United States. And so the timing of those treatments are going to vary. And then age of animal have an impact. And so if we're just treating adult animals, typically a microcytic lactone, and some examples there would be Cydectin, Epernex, Dectomax. They work really well on those animals, and that may be all we're using. If we're looking at keeping some replacement heifers or we're keeping some calves past weaning, in addition to that microcytic lactone, we may also want to use a white dewormer in that situation because those animals less than a year of age can have a problem with a group of internal parasites known as the Capiria species that typically aren't a problem in our older animals, and those white dewormers work better on that Capiria species. And then when we come to dewormers, make sure that you're using a legally approved product and a product that has been proven to be efficacious. I've gotten more questions and comments on soap lately. Soap is not a dewormer. That is not an approved product. The other thing is, would you want somebody giving you soap to eat? So think about that. The other one that's come up here lately is vinegar. Vinegar is not a dewormer either. I'm not aware of any research that would show any benefit there. And when we kind of think through vinegar, remember, vinegar is acetic acid. Acetic acid is actually one of the main fatty acids that's produced in the rumen. So producing or giving that animal additional vinegar is likely not going to help. The other thing is when we think about internal parasites, those internal parasites are typically going to be found in the abomasum, which if you think about the digestive system, you have the reticulum, you have the rumen, then you have the omasum, and then the fourth compartment there is the abomasum. Well, that vinegar would be absorbed before it ever got to the abomasum. And then after the abomasum, we have the small intestine. So those internal parasites are in the abomasum in the small intestine typically. So one of the questions that came in is what would be an example of a white dewormer? So if we're talking about those animals less than a year of age, we would look at using one of the macrocytic lactones, like I mentioned, the Cydectin, the Epernex, Cydectomax. But then if we were wanting to use a white dewormer as well, examples there would be things like Safeguard, Panicure, Valvacin, and Synanthic. Those are typically going to be drenches that we're going to drench the animals with. With Safeguard, there is a paste that you can use, and also with Safeguard, there's a block, there's a pellet, there's a cube you can use in situations as well. So those would be examples of white dewormers. So hopefully that answered that question. If not, go ahead and chat back in and we can visit a little bit more on that. But making sure we take care of those internal parasites, it helps us from an animal performance standpoint, but it also helps us from a herd health standpoint as well. When we think about treatment of external parasites, it's similar. So when we think about treating those external parasites, it helps the animal from a nutritional standpoint because think about most of our external parasites, horn flies are going to remove blood, lice are going to remove blood, and so that has an impact on animal performance and overall nutrition and health. And so by reducing those external parasites can help. The other thing is some of the external parasites can transmit disease. And so by reducing those populations can also help with reducing disease. One of them that we don't have in most of Central and East Texas, but as we get closer to Oklahoma, we may have an issue with it, especially Oklahoma and Kansas, is anaplasmosis. And one of the main ways that anaplasmosis is treated is by ticks. Um, and so if you're in an environment that has ticks, then reducing that tick population through treatment should help reduce transmission of anaplasmosis some. The other thing is some pathogens can be transmitted by flies. So if you think about pink eye, those flies can actually transmit the pathogens that cause pink eye from one animal to another. And then there's some of the blood-borne diseases that could be potentially transmitted by flies. The data is not real clear, and there are some varying opinions, but that is a possible transmission route as well. So just like when we talked about the internal parasites with the external parasites, we do that because we get a benefit in animal performance. It's also valuable from a welfare standpoint, but there's also important application from an immune function standpoint and a herd health standpoint as well. And I mentioned lice earlier. Lice can actually reduce red blood cell counts of cattle by 75%. So if you've ever gone to the doctor and they checked to see if you were anemic, they were actually checking your red blood cell in those situations. And so making sure we keep those animals healthy and without lice can have a pretty good impact there. And then remember, both horn flies and stable flies can have impacts on average daily gain. So then the next thing is we want to talk about, well, what are some of the diseases? And this is just going to be a short list. There's a long, long list of cattle diseases out there. We're just going to talk about some of the more common ones. And it's important that you're aware of these because that's going to help you determine what your herd health program needs to be and if it's a disease that we're going to vaccinate for or not in those situations. So when we think about some of the common pathogens out there, the first group I'll talk about is what we would call the clostridial pathogens. This is what, when people think about blackleg is one of several clostridial pathogens. And so when you think about a 7-way, 8-way, or 9-way clostridial vaccine, that's what we're talking about here. Sometimes people call those blackleg vaccines, but again, blackleg is just one component. The other thing to keep in mind with these Clostridial pathogens is most of these are found in the soil. And so your animals are always exposed to these. And so it's something that every operation should definitely consider vaccinating for. And then we think about our viral respiratory pathogens. And so the diseases those cause would be IBR, BVD, PI3, and BRSV. And people think about that from a pneumonia standpoint. And typically, that's not a major problem in a cow-calf operation, definitely in a stocker operation. That's something that they deal with quite a bit. Or if you're selling calves into a preconditioned uh, cell, that you would be required to vaccinate against those diseases. The other thing to keep in mind is both IBR and BVD, in addition to respiratory illness, those can actually cause reproductive loss in cows. And so even though we don't think about respiratory issues in adult cows because of the IBR and the BVD and their reproductive issues, we definitely want to be vaccinating those cows for that as well. In reality, because of the way vaccines are sold, you're probably going to buy a vaccine that has the IBR, BVD, PI3, and BRSV in it all together. The other thing is when we talk about BVD, and BVD stands for bovine viral diarrhea, is we can actually get in a situation if that cow gets infected with BVD when she's pregnant, between about 30 and 125 days of gestation, if she gets infected in that window, that developing fetus won't actually recognize that BVD virus as a pathogen. It will think it's normal. And so it won't develop an immune response to that. And so when that calf is born, it's persistently infected with BVD the rest of its life, and it's constantly shedding BVD virus into the environment. And that's one of the main ways BVD is transmitted. And so that's important. And we'll talk about that a little bit later when we start talking about buying cows and where you're buying cows from and what stage of gestation they're in. It's just remember if those cows get infected between 30 and 125 days of gestation, we can create those BVD PI calves there that are persistently infected. And then lepto is one of those pathogens that causes reproductive loss, and it can be in the water. An animal sheds it, it's in the water. Another one gets exposed to it there. Livestock species can carry it. So it's one that most operations need to be mindful of and probably include as part of their vaccination program. Now, if you're in a really, really low rainfall environment, that may change your risk of lepto. But definitely in a moderate to higher rainfall environment, lepto is something we want to be mindful of. Vibrio is one of those pathogens that's transmitted through breeding activity. And so if you have a pretty good closed herd, that may not be as big of a concern for you. If you're bringing animals in and out, Vibrio may be something you want to be more mindful of. And then there are several different pathogens that can cause scours in calves. There are vaccines to help reduce those. Those are typically not something we have to use in most operations unless you're having a problem. If you are having a problem with calf scours, vaccines may be one tool in the toolbox to use there. But if you're going to do that, there's some very specific timing of when you need to give those. And typically that may be more advantageous in bred heifers than it would be in cows, but just something to keep in mind there. The other way we can kind of manage calf scours, and part of the reason we don't have as much problem with calf scours is because of the way we calve. So if you're calving in pastures and those cattle can get spread out, that spreads that pathogen out. Sunlight in our environment does a really good job of reducing the pathogen loads. If you're calving in a barn or something, like that, and you're doing that throughout the calving season, that greatly increases your risk of calf scours in that situation. One strategy they'll use in certain environments is put all the cows in a pasture, let them calve for 2 weeks. After 2 weeks, leave the pairs in that pasture and take all the remaining bred cows and move them to another pasture. And again, let them calve for 2 or 3 weeks and then move them. the remaining bred cows to another pasture. And what that does is reduce the overall pathogen loads in the pasture. And we do get a little bit more pathogen shedding from those older calves, which creates some of those scour problems in those younger calves. And so kind of spreading them out like that helps reduce that. And then when you get those calves a little older, then you can bring them all back together in one group. For a lot of you, that's probably not something you need to worry about. If you're not having any problems, don't worry about it. But if you are having problems with scours, in addition to vaccine, there are some management strategies we could use there. And then we got to remember, so the pathogens I just talked about, those are going to be pretty common across most of the cattle industry. But then there's other pathogens that we find in certain areas and we don't find in other areas. So parts of Texas, we have some anaplasmosis, but a lot of areas of Texas, we don't have much, if any, problem at all with anaplasmosis. But then, like I said, when you get into Oklahoma and Kansas, that kind of changes things. So that's something to be mindful of. And that would be something to be mindful of if you're bringing animals in from that area that have been exposed to anaplasmosis into your operation, especially if your animals have never been exposed to anaplasmosis. That would be something to be mindful of. One of the viruses that you probably haven't heard about is one called foothill abortion. They typically have this in the mountainous regions of California, Nevada, and Oregon. And those animals that are born and raised in that environment and have been exposed to it, it's not as big of a problem for them. But if you bring animals that are naive to that virus into that environment, we can see really high rates of abortion in that situation. And so knowing the pathogens in your area and maybe knowing some unique pathogens in some other areas can be important if you're thinking about bringing animals in from those areas or moving animals to those areas. Brucellosis is one of those we used to have to worry about in Texas. Texas has been a brucellosis-free state for many years now. But if you're running cattle around the Yellowstone National Park, we still have some brucellosis issues there. And that's because that brucellosis is maintained in the elk population and the bison populations up there. So you have to be mindful of those kind of things. And then there's some unidentified pathogens that cattle raised in a local area have built an immunity to, and we really don't think about them. But if we move new cattle into that environment, we can get into some problems in those situations. I'll just share a story. There was a seed stock producer in another state that got access to some new property a couple hours north of where they were. So they took a pretty sizable chunk of their cow herd, moved them to that new property. There was a virus that was a problem in that area that was transmitted by the wildlife that their herd hadn't been exposed to previously. And so the first year there, they saw some pretty high reproductive loss in those animals. So a lot of times you hear you want to try to buy animals from your area if you can. And disease exposure is one of those things, is one of the reasons you'll hear that from time to time. Some other pathogens that are out there, trick. And so remember, trick is a protozoal parasite treated or transmitted through breeding activity. So an infected cow can give it to a bull, and then that bull can spread it around the rest of the herd. Or if that bull's infected, he can give it to uninfected cow. Cows can clear that infection with rest from breeding activity, so they'll abort. And then if you give them a few months, they tend to clear the infection. But a bull, once he gets trick, he has trick. And so trick is one of those pathogens we really want to manage from a biosecurity standpoint and not bring in our operation. There's not any kind of treatment for trick. There is a vaccine, but the thing you got to remember with the trick vaccine is it doesn't prevent infection. It helps increase the clearance rate in the cow herd. So the vaccine's not going to be a magic bullet in that situation. It's just a tool to help you manage through a trick infection. And then one that you may have not heard of is actually a bacterial infection called Johne's. If you've heard of Crohn's in people, it's somewhat similar to that. But what Johne's does is it's a bacteria that can be transmitted to the developing fetus. So if the cow's infected with Johne's, she can pass it to her fetus in utero, and then when that calf's born, he or she's infected with Johne's, or the bacteria is shed in the manure. And if some manure gets on the udder or the teat of that cow, and that calf sucks and gets exposure to that bacteria there, they can get infected. So transmission in utero or transmission to those young calves are the primary routes of Johne's transmission. The thing that Johne's does is it impacts the digestive tract of those animals and degrades it over time, and it will cause those animals to have severe diarrhea. They can't absorb nutrients the way they need to. They'll just constantly lose weight until they're euthanized or they die in those situations. And so that's one you definitely don't want to get in your operation, um, and make sure you're aware of there. All right, so that's some of the common diseases and some diseases to be aware of. Kind of the next thing I wanted to talk about is biosecurity then. And so, what are some biosecurity considerations when we bring new animals in? You definitely want to isolate those animals from the rest of the animals in your operation. And the amount of time you should isolate them, it kind of varies depending on the situation. And in some situations, in reality, you can't isolate them long enough, but there's kind of a reasonable amount of time. At least if we isolate them that long, we can help eliminate or reduce a lot of problems. So in most situations, at least 2 to 4 weeks. And the reason we're isolating those animals for 2 to 4 weeks is, one, if they are sick, it gives them time to get over that infection. It also gives us time to go ahead and treat them or vaccinate them if we need to. So any new animals, we want to deworm them when we bring them into our operation. We want to treat them for lice. If we don't know the vaccination history, we want to vaccinate them in those situations. I mentioned the BVD PI animals earlier. So there is a really good test for BVD PI. You can test that with blood or tissue samples, would be the two most common routes. And so there's a couple ways we can go about that. Any new animals you bring in, if they're not pregnant, then test everybody. If they're pregnant cows that are about to have calves, or if they're pairs, then we can test the calf and not necessarily the dam. If the calf is negative, we know that cow is going to be negative, so you don't have to test everybody. The key is if that cow loses a calf before you get it tested, then make sure you test that cow that lost a calf when you're testing the rest of the calves out there. Um, and then um, eh, just make sure you either test the calf or any cows that don't have a calf. And then if you do that, you know you're in a good shape from a PI standpoint. Now, if those are going to be short or medium bred cows, I'd go ahead and get the cow tested. I wouldn't wait until they calve. So you know what you're dealing with in those situations. And then there's other diseases where if we bring a new animal in, that has an infection and your animals don't have immunity to that particular pathogen, we can have some problems. Anaplasmosis is one of those. The place I'd really be mindful of that is if you're buying bulls from out of state, make sure you know kind of whether that area has an issue with anaplasmosis or not. If you have an issue with anaplasmosis in your operation, you want to buy bulls from areas that have issues with anaplasmosis, because same thing, if you have anaplasmosis in your herd and you buy bulls from an area that doesn't have anaplasmosis, that can cause issues with those bulls. If you're with those bulls that were naive. If you're not familiar with anaplasmosis, it's actually a bacterial pathogen that causes severe anemia in animals. The kind of interesting thing is if those animals get infected when they're young, they typically don't show too many symptoms. We don't have any problems with them. They have the infection all their life. It'll kind of cycle up and down, but not that big of a deal. However, if they don't get exposure and build immunity as calves, and they get exposed when they're older, then it can be fatal in that situation and cause much more severe illness. So I actually was talking to a producer probably 2 years ago. He had bought some seed stock cows from an area that had some anaplasmosis. where he was at, one of the northern Great Lakes states. They don't have any anaplasmosis. So he brought those animals in. They had anaplasmosis. His herd was naive to that and had some pretty big issues there. So that's just one example of some diseases we have to be mindful of where we're buying cattle from or where we're moving cattle into from. As cow-calf operations, we really need to be mindful of higher risk animals. So those stocker animals, so those stocker calves or feeder calves from a sale barn, we don't want to mix them with the cow herd. They've been exposed to a lot of different pathogens out there, and they would be high risk. One that a lot of people don't think of is people like to keep a milk cow around sometimes to put calves on if they have a cow that dies or something. Those milk cows can be some high risk animals, and so that's something you have to be mindful of. And then if you have a cow that loses a calf, you also got to be real mindful of going out and buying a calf and putting on there, because you can really create some problems there and bring in some disease and definitely increase scours risk in your herd. So you really want to avoid introduction of those high risk animals into your herd if you can help it. If you are going to do some of those things, then at least get those animals isolated from the rest of the herd for that quarantine period we were talking about. The other thing is be mindful of introducing newly purchased pairs. If you currently have pairs in your herd, so let's say you're calving and you want to add a few more cows and have them all in your calving season, you have your pairs. When you bring those new pairs in, that can really increase risk from a scour standpoint and a respiratory disease standpoint. So if you're bringing new pairs in, make sure you keep them isolated for, in that situation, I'd want to keep them isolated for at least 4 weeks before I mix them in with the cow herd. Now, sometimes you can do it and you won't have any problems. Other times you do it, you can definitely have some problems. I talked to a producer last week who had done that unknowingly and created some scours in his operation and actually lost some calves because of that. Be mindful of where purchased animals are coming from, and what animals you are purchasing. So obviously, if we think about an auction market, and auction markets are great, they're very important to our industry. But because of all the co-mingling of those animals there, we do have more disease exposure in that situation. So if we're bringing animals in from an auction market, even if that's a special female sale, or even if that's a bull sale, where they're holding it at the auction market. We need to be mindful of that and keep that in mind when we think about that quarantine and isolation period and the risk. That's going to be higher risk than if you go and buy some cattle private treaty from the neighbor down the road. So we got to think about that risk level and what that means. Stage of gestation. So when you're buying females, we talked about those females where if they're infected with BVD between about 30 and 125 days of gestation, we can create those BVD PI calves. Um, and so in that situation, you'd be better off or less risk buying late bred or long bred females than you would be buying those short bred females if they're being exposed to a lot of other animals at the sale. So think about those. Trick is one to be mindful of. So if you see a big herd sell out and they have long bred, medium bred, short bred cows, and then a whole bunch of open cows, that should be a bit of a red flag for you that you have an increased risk of trick there. And so you got to be very mindful of that, especially in those open cows and those short bred cows. We do have less risk of trick in those long bred cows. So just be aware. I watched a big herd sellout a couple of weeks ago, and probably half the cows were open in that situation, and people were paying some really high dollar for those bred animals without giving any consideration to why is half the herd open in this situation. So just keep those things in mind, because that's part of your herd health plan and making sure you try to avoid bringing problems in. Now, if you're going to buy those high risk animals, you need to keep them separate from your animals, make sure you keep a separate bull there. And after that breeding season, you know what that bull is, and make sure you don't put him back in with another group of cows. That bull you'd want to go back to that same group so that if you had a problem, you would at least isolate it to that group of newly purchased cows rather than mixing it in with the rest of your herd. Another thing to be mindful of from a biosecurity standpoint is mixing animals that you own from different properties. So let's say you have multiple properties, whether you own those properties or lease those properties and it's weaning time, bringing all those calves together at weaning, there's a little more risk to that, especially if you had a BVD PI calf in one of those groups. All of its herd mates would have been exposed all along and they would have had pretty good immunity to it. But if you take that PI calf and mix it with some other calves that have just been weaned that don't have that immunity yet, that can be something that can cause you increased problems there. Now, a lot of times we can mix cattle together from our own operations without any issues at all. But there are times where, especially if we don't have a good vaccine program in place or we bought some higher risk animals, where it may not seem like we're doing anything out of the ordinary, but there could be something that creates more risk for us there. So with trick, remember that's that protozoal parasite I was talking about, and I was just talking about being mindful of what type of cows you bought. But from a trick standpoint, good fences are important. You want to keep the neighbor's bulls on their side of the fence, and you want to keep your bulls on your side of the fence. If you do have neighbors' bulls that are coming across, you may want to see if you can get a trick test on that bull so you know where you're at. Unfortunately, those trick tests aren't perfect. A lot of people you talk to would tell you to really feel comfortable, you would probably want 3 negative tests on that bull. But at least if you got 1 negative test on that bull, that gives you a little bit more um, confidence and risk reduction there. So be mindful of those. I already talked about the herd sellouts and the large number of open cows to be aware of. And then long bred cows are going to be less risk than open or short bred cows when it comes to trick. Yonis is a problem that seems to be increasing in beef cattle. I'll tell you, I've actually worked with some producers that unfortunately have purchased some pretty high dollar bulls here recently that were infected with Yonis. The other thing I didn't mention about Yonis earlier is typically we don't start seeing the issues with Yonis until those animals get older, a lot of times 4, 5, and 6 years of age, but sometimes we will see it a little sooner. In both of these bull situations, and these were well-known seed stock operations these bulls came out of, is these bulls were showing up around 3 years of age with Yonis problems there. I suspect what's probably happening in some of those situations is with the use of embryo transfer. That's a great technology from a genetic standpoint. But if somebody is putting those embryos in recip cows of an unknown history, which unfortunately happens a lot, that could be a way where we're starting to see some more yonis coming out of some of those seed stock operations. Unfortunately, yonis is really challenging to deal with. There's not a treatment. The testing is not real great in that situation, so it's really best to avoid bringing that into your operation. A lot of people think Yonis is just a problem in dairy operations, but it definitely seems to be a growing problem in our beef operations as well. So just some things on vaccines is remember when we talk about vaccines, there's kind of 2 types of vaccines, what we would call a killed vaccine, which that vaccine is going to be really safe. We can use that in almost all situations. But with killed vaccines, generally, if those animals have never been vaccinated, you're going to give 2 doses initially and then an annual booster after that. When we talk about modified live viral vaccines, that's typically we're talking about our IBR, BVD, PI3, and VRSV there. That's going to be 1 dose initially, and then we're going to need to check the label and company recommendations regarding revaccination. There are some things we have to be mindful of from a reproductive standpoint on the modified live viral vaccines. So if you're unsure, killed vaccines are a safer way to go. If you are looking at using a modified live in the cow herd, just make sure you're talking to an industry expert or veterinarian who really knows that situation because sometimes we do see some reduced reproductive performance with some of those modified live viral vaccines, even when they're used according to label directions. They're very important when we think about our stocker and our feeder cattle, but when we think about our cow herd, we really need to think about a risk and what that means there. And then we do have some vaccines that are a combination of killed and modified live products. And what we would typically do there is we'd give one dose initially, and then we're going to come back and follow that initial dose with that second dose of the killed components. And then after that, an annual booster of the killed components. So what diseases do we routinely vaccinate for? And remember, there is a Ag in the Evening topic that's just on vaccines that will go into a little more detail than what I'm going into right now. But what we routinely vaccinate for in both cows and calves would be those clostridial diseases, the IBR, BVD, and then as I mentioned, because of the way products are sold, the cows would get the PI3 and the BRSV just like the calves would, lepto, and then Vibrio is kind of a herd by herd situation, whether it makes sense to use Vibrio or not in your operation. I mentioned when we talk about the modified live viral vaccines, definitely for our stocker and feeder cattle, we're going to want to use those for breeding animals. The opinions vary out there, so visit with your veterinarian or industry expert. Like I said, there does appear to be a growing amount of concern out there. There is one really big study out there that showed even when used according to label directions, they consistently saw numerical reductions and pregnancy rates for using the modified live viral vaccine compared to a killed vaccine. So just kind of as a reminder, what are some of the products that are out there? So when we talk about our Clostridial vaccines, these would all be Clostridial vaccines that are on the market. Most of those would be a 2 cc dose, but some of them we do see a 5 cc dose. And then when I say multiple products, that just means like for Ultra Choice there, you could buy Ultra Choice by itself. You could buy Ultra Choice with Haemophilus somnus in there, or you could buy it in other combinations. So you kind of have the main product, and then you may have some various combinations that go along with it. Now, when we think about our killed viral vaccines, there's really only two product lines out there that are going to have killed IBR, BBD, PI3, and BRSV. And that's going to be the Triangle product line, and that's going to be the Virus Shield product line. You can see with Triangle, they kind of have three products on the market. Virus Shield has probably way more than what we really need in all actuality, but there's 11 different products out there. So what would be some examples of basic vaccination programs if we're talking about killed viral products? And so these would be safe for most animals, regardless of their pregnancy status. So what we would do with killed products is annually we'd give a clostridial vaccine. So we could pick one of the four over there on the left-hand side. And I just listed one from each company. In general, I would say we probably want to use an 8-way. So we do have the red water component in there. And then the 9-way would have everything in the 8-way plus tetanus as well. Some operations need tetanus, some don't. And then the two options there from a killed vaccine with their respiratory and our lepto in there would be Triangle 10HB or Viral Shield 6 L5HB. So basically pick one from the left-hand box, one from the right-hand box, and that would be a good annual program for most operations to kind of cover those basic diseases we were talking about. Doesn't cover everything, but it's a good starting spot in a lot of situations. And then if we are dealing with modified live, what would be some options there? So Merck is one option. So their Clostridial product, Vision 8 would be a good option. And then Vista 5, L5. There are label restrictions on when and how you can use that Vista 5, L5. So make sure you read those, talk to the company if you're not sure in those situations. And then from Zoetis, if you wanted a modified live product, so Ultra Choice 8 would be our Clostridial vaccine. Cattle Master Gold, FP5 would be our IBR or BVD or PI3 and BRSV. Cattle Master Gold's a little unique. It actually is a combination of modified live and killed there. And then to get to the Lepto, they don't have that in combination with the Cattle Master Gold. Spirovac L5 would be our Lepto vaccine in that situation. So those are just some examples of kind of some basic vaccine programs. The next kind of thing I think about from a herd health program is our treatment plan. And that treatment plan will vary by pathogens, but remember, it's going to be a whole lot better and cheaper to prevent those diseases than try to treat or manage them in most situations. The exceptions to that is there are some diseases where the most effective strategy may be to actually let those calves get infected and build immunity so we have that immunity in the cow herd moving forward. When you are working on that treatment plan, make sure you work with a reputable veterinarian who has good cattle experience. Remember, all antibiotics do require a prescription these days, so you are going to need to get that prescription through the veterinarian for that antibiotic. The other thing is antibiotics are only effective on bacterial infections. They're not going to work on other infections. They're not going to work on toxic plants. They're not going to work on a lot of other things. They're to treat bacterial infections. So we have to be aware of that and use them when we need them, but not just use them just to use them when we don't think there's going to be a true benefit there. And then when we think about our protozoal infections, for most of our protozoal infections, there's just not any treatments. Remember, trick was an example of that. Um, I guess it kind of fits into the herd health program. I wanted to just mention a little bit about toxic substances and a lot of things times we're thinking about toxic plants in this situation is the way we help reduce our risk there is one, herbicides that we can use to spray those plants. And the benefit of the herbicides is it kills that plant that could be toxic at a certain point in time. The other thing is by killing those weeds, we can produce more forage there. Unfortunately, shredding doesn't help that and can actually create some more problems if we're reducing the amount of forage. The other thing is avoid overgrazing. When we overgraze, we increase the likelihood of those animals consuming something we don't want them to. If there's plenty of forage out there, a lot of those plants, they never even bother. But if we do start to overgraze, then suddenly they may start to consume something that they wouldn't in other situations. And then kind of some final considerations is there are some bloodborne diseases that we can transmit through equipment. So if you're castrating, knife castrating, just make sure you do disinfect that knife and any other equipment between those animals. If you're dehorning, you would want to disinfect that as well. Really, the best way to dehorn is going to be through a genetic standpoint and using pole bulls. But if you are dehorning, just make sure you do disinfect that equipment. And then some considerations from a needle standpoint. In some situations, some people do desire or do change those needles between each animal if they're worried about some bloodborne pathogens. That's something you just have to look at the risk in your operation and decide whether that makes sense or not. In other operations, we may use that same needle in multiple animals. And then just remember from a BQA standpoint, the rule of thumb is anytime that needle gets dull, gets bent, gets dirty, we want to change it. Otherwise, we want to change that needle roughly every 10 to 12 head. So just depending on what fits best for your operation. And that's what I wanted to cover. So feel free to go ahead and put questions in the chat box. And I'll go ahead and allow people to unmute themselves again. I adjusted that during the presentation. Okay, so the question was, does Texas require trick testing for bull cells or bull movement? So, as with a lot of things, it depends. If we're talking about those bulls changing ownership and they're over a certain age, then trick testing is required. If those bulls are changing ownership and they're under a certain age and the breeder can will sign paperwork saying they're virgin bulls, they may not have to be tested in that situation. Okay, question was, is it necessary to feed mineral with IGR year round? And I'll tell you, that's one I've kind of changed my opinion on just slightly over the last couple years. I do think there is some advantage to feeding mineral with IGR in it year round. because we do see a few horn flies throughout the winter. With that being said, I realize it can be hard to find mineral with IGR in it year round. I do know some operations that started feeding that mineral later in the season here recently, and they saw really good results. So I think with that being said, as long as you can start feeding that mineral early in the fly season, I think that's probably sufficient, and most people will be satisfied with that. If you are able to feed it year round, that's great. So either way works there. The biggest thing with IGR and the mineral is make sure you're using the methoprene with a 0.014 concentration and not the 0.01. It makes a real big difference, that 0.14. And so a lot of the negative feedback I get when people aren't getting good fly control out of IGR is because they're using that low concentration, and that's just not enough for the size of cows we have. But if you'll go to the 0.014 and your cows eat mineral well, then we are seeing a lot of positive results from feeding the IGR, whether it's year round or starting it at the beginning of the fly season. So starting it late March or April and then feeding it through November. Okay, question was somebody's getting ready to buy some bulls from a reputable breeder, wanted to know about deworming them before you unload them. I definitely would deworm before I would unload those bulls. At minimum, I would use a macrocytic lactone on those bulls. If you want to go ahead and use a white dewormer on them, that's fine as well, since you are bringing them in. Now, normally on older bulls, we wouldn't do that. But if you did want to use both the macrocytic lactone and the white dewormer on those new arrivals, that's fine. If you just use the macrocytic lactone, that's fine. That's what I typically do. But I definitely would deworm them. And then I would just make sure I would isolate those bulls if you can for a couple of weeks before you mix them in with anything else, unless you're in a situation where you need to start your breeding season immediately. So the symptoms of Johne's disease are going to be weight loss and severe diarrhea in those animals. I'm not seeing any other questions, so I'll go ahead and wait around a little bit here in case there are some other questions. But if you don't have any questions, thank you for joining and feel free to go ahead and log off, and hope you have a good evening.